Have you been prescribed tamsulosin, also known as Flomax, or Finasteride, which many people know as propecia or proscar, for prostate issues, or maybe even for hair loss? Well, I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to talk about some truly surprising side effects you should be aware of when taking these medications. I'll also explain whether these side effects disappear after you stop the medicine. And be sure to stay with me until the end to learn the full story. If you're new here, I share urologic health content, so if you enjoy what you see, don't forget to subscribe and share this channel with your friends. The next medication is Finasteride, also known as proscar. Urologists commonly prescribe it for an enlarged prostate. However, this medication is also used at a lower dose to help people dealing with hair loss. Interestingly, some individuals experience notable sexual side effects while taking it. So how does it actually work? Finasteride blocks an enzyme called 5-alpha reductase. This enzyme exists in several areas of the body, especially the prostate, but it's also present in the brain. The medication can cross something known as the blood-brain barrier. Once it does, it may interfere with 3 neuroactive steroids, DHT, 5-alpha dihydroprogesterone, and 5-alpha dihydrodeoxycorticosterone. Although scientists don't fully understand the process, researchers believe that lowering the levels of these molecules in the brain could influence areas involved in sexual desire. As a result, some people may experience a reduced libido. Most studies examining how this medication affects the brain have been conducted in animals, which is why we still don't have a clear explanation of exactly how or why it impacts the brain in this way. If you read the official medication labeling, it states that there's less than a 10% risk of issues such as impotence, reduced sex drive, ejaculatory problems, or general sexual dysfunction. The encouraging news is that if you've been taking the medication for more than a year and haven't noticed any sexual side effects, it's unlikely you'll suddenly develop them later. However, researchers have also studied men who did experience sexual side effects while using Finasteride. In one survey of 71 men who developed what's called post-Finasteride sexual dysfunction after using it for hair loss, the findings were striking. More than 90% reported decreased libido, lower arousal, and difficulties with erections. Nearly 70% of the men also reported difficulty reaching orgasm. The most alarming finding came when researchers looked at how long these sexual side effects continued after stopping Finasteride. On average, the symptoms lasted about 40 months, which is almost 4 years. Even more concerning, 20 of those men experienced symptoms that continued for more than 6 years. On the other hand, there's another concept known as the nocebo effect. Many of you are familiar with the placebo effect, but the nocebo effect represents the negative version of that idea. Essentially, when people are warned about possible side effects, they may become psychologically more likely to believe they are experiencing them. This is one reason doctors consider carefully how they discuss potential risks with patients who later report sexual side effects after being informed about them. The final group of medications I want to discuss is something urologists prescribe very frequently. These are called alpha blockers, and the one most commonly linked to side effects is tamsulosin. One issue some men notice while taking it is a reduced amount of semen during ejaculation. With tamsulosin in particular, this can occur in about 8 to 18% of men, depending on the dosage they're using. The medication can affect ejaculation in a couple of ways, leading to either lower semen volume or, in some cases, no ejaculation at all. One reason is that these drugs block alpha receptors. These receptors are located in the bladder neck and in the seminal vesicles. In fact, about 80% of ejaculate fluid comes from the seminal vesicles, which is why they play such a major role in semen volume. They also contain a large number of alpha receptors, just like the bladder neck. Normally, both areas contract together to help push semen out of the body through the urethra. Another possibility is that tamsulosin may attach to certain receptors in the brain, such as serotonin or dopamine receptors, which could interfere with signals between the brain and the spinal ejaculatory center. preventing ejaculation from occurring normally. Interestingly, when men are informed beforehand that a medication might cause ejaculation problems, about 70% say they would probably choose not to take it if that risk existed. That's why it's important to know that if you're experiencing these symptoms while using one of these medications, you should speak with your urologist or primary care doctor. There are other options besides tamsulosin, including terazosin, alfuzosin, and doxazosin, and these tend to have much lower rates of ejaculatory problems. According to available data, alfuzosin appears to have the lowest rate, around 0.6%. On the other hand, tamsulosin and silodosin are associated with the highest rates of ejaculatory dysfunction. I truly hope you found today's video helpful and informative. As always, remember to take good care of yourself, because you're worth it.